Good morning. Thank you for listening today. My name is Kim Richardson, and I'm a nurse on the Atlantic General Med-Surg floor. As fellow nurses, do you ever feel stretched thin at work? Through research, I have uncovered some serious concerns with our current staffing policy. The current nurse-to-patient ratios of 5 to 1 on day shift and 6 to 1 on night shift present many issues in regards to patient safety and satisfaction. It also contributes to nurse fatigue and the effects that may have in relation to patient care. We will review some of the contributing factors to the safety concerns of the current policy and also review the benefits a new policy that lowers ratios would bring to the fore. With the current policy, patient needs are not always being met, and that's unacceptable. Keeping up with call bells and the changing orders from the doctors can be very difficult for the nurses with a workload of that size. Staying in the hospital is already inconvenient for the patients. If they've hit their call bell and they have to wait to use the restroom, have their water refilled, for a pain medication, or to even go for a walk, that can all contribute to lowered patient satisfaction. When making staffing assignments, there are many things to consider. Something you can ask yourself when receiving an assignment is, do I have the appropriate knowledge or experience to care for this patient? What are the characteristics of the patient? What is their age? Were they admitted from home? What about a skilled nursing facility? Those things can contribute to patient safety and satisfaction. Also, can I take this patient in good faith? Patient safety incidents increase when a nurse workload is too large. Some things that are called safety incidents are falls, wrong documentation, late medication or missed procedures. All of those things are examples of safety incidents. Atlantic General also has a large elderly population. This results in requiring extra care to be given when eating meals, going for walks, or just the general basic care. The elderly requires extra attention. The American Journal of Nursing states that when the nurse workload is increased, safety incidents go from 8 to 34%. When a nurse workload is decreased, the safety incidents also decrease by 25%. Being a patient advocate is a large part of nursing, caring for the patients as a whole, being able to recognize their needs upon discharge. Will they need therapies, certain rehabs? Those sorts of things are all part of caring for the patient as a whole. Having the time to educate them on their illnesses to reduce returned hospital stays. What are the risk factors or warning signs of their disease processes possibly? What are some things they can do to modify their lifestyle? Educate them on their medications and side effects. Those things can reduce returned hospital stays and are part of caring for the patient as a whole. All of these things take time in a nurse's day. For example, I have a chart here that shows a diagram of how a nurse spends their day. 35% of their time is spent just doing documentation. That's more time than the time they spend doing patient care and assessments combined. Other parts of their day are care coordination. This could be with therapies, case management, pharmacy, the doctors, and also medication administration. That's also a large part of the day. Another chart I have here is a chart that shows safety incidents versus nurse workload. Right here you can see this would be the ideal level of 1 to 4 would be for a nurse. The safety incidents are very low. The increase from 6, 8, 10, and 12, you can see how large that goes. Right here is a chart I know might be a little difficult to see, but it's proposed federal RN nurse to patient ratios, and it states here in the corner that for med-surg it should be 1 to 4. So that would make a big difference if we could get that ratio to be more ideal. Those patient safety incidents would go way down. For nurse fatigue, some contributing factors are definitely staffing imbalances and being overworked and stretched thin, monitoring patient statuses, intake and output, vital signs, medication reaction, and toleration. Those things are all part of fatigue. You get overworked when you have a patient workload of 6, for example, on night shift that I work. Monitoring patient statuses is very time consuming. Also, managing your professional and personal lives also contribute to nurse fatigue. Outside of work, you need to make sure that you're getting enough sleep, having enough exercising, and eating a good diet. All those things can help combat nurse fatigue. Some benefits of lowering nurse fatigue, or from easing nurse fatigue, would be more time for patient education, more thorough patient care, less turnover rate, and increased employee satisfaction. American Journal of Nursing states that when nurses have more time with their patients, there are less adverse reactions. The Registered Nurse Staffing Act also states that hospitals should be held accountable to have safe nurse staffing plans. The benefits of a new policy would be lowering the nurse to patient ratios, obviously. This would result in patient satisfaction being increased, as well as less safety incidents on the floor. We had a survey conducted of the nurses on Atlantic General Hospital on the med-surg floor, and it was overwhelming. As you can see here, this was all the percentage of the nurses being in approval. Very small percentage was unsure or a no. The reasons that they were unsure is they felt that if the staffing assignments were made more reasonable, that we wouldn't need less patients. But again, that was a very small percentage. Most of the nurses, as you can see, was overwhelmingly supportive. In conclusion, the feedback of implementing a new policy that lowers nurse to patient ratios was overwhelmingly supportive. We as nurses recognize that sometimes making small changes can have a huge impact on patient care. Making this change in the policy can only enhance the personal relationships that we have in our community hospital, which is a large part of why our patients come back. They like the personal care that they receive at Atlantic General Hospital. It will also ensure higher patient safety levels, which is the utmost priority in patient care, as well as result in increased employee and patient satisfaction on the med-surg floor at Atlantic General Hospital. Thank you for your time and have a nice day.